Welcome back to forpay.org, one-stop place for healthcare costs, rising healthcare costs. And this is Consumers Dr.VANGALA. I'm on your side. We want to make sure that you save money on healthcare. If you have a deductible health insurance with health savings, I want you to save every penny. Especially when your doctor tells you to go to the hospital. That's one thing I learned the hard way. And when you go to the hospital, folks, they take you via the emergency room. That's the trick hospitals use all the time. And they say you have to see the doctor, ER doctor. They took me for an angioplasty. My physician told me to go to the hospital. I said, okay. I go to the hospital. They put me in a gurney, and they said, you have to see a ER doctor. I said, why? Because me being a physician, I said, why? I said, I don't want to see a ER doctor. I said, no, that's a routine policy. What do you do? This is where you need to be stubborn. Before you even get into it, you really need to stick to that issue. I want to have my procedure done as an outpatient, and my doctor had told me to come to the hospital. I said, fine. Anyway, if you can bypass the ER, believe me, folks, you'll be saving at least $5,000 to $10,000 just bypassing the emergency room. You know why? It's once you get into the ER, they draw your blood, the ER doctor, the EKG, it's like a ATM. It's just bills start piling up. So every time you get into the hospital, you get in touch with your tech or get in touch with the nurse. There's a charge, folks. There is a charge. There's nothing for free, man. There's nothing for free. I'm telling you. Even if they go and get you a Tylenol pill, it costs you $8 to $15, folks. There's nothing free in this world, man. There's nothing free. You need to stick to it. Okay, if that's what it is, you need to figure out a way to lower the medical bills. In the hospital, you can try, but it's going to be hard. But in the hospital, I wish. You want to control the cost of your medical because you have a deductible plan. You want to save money on your outpatient. There's another thing, folks. I would rather go to a surgery center than a hospital outpatient, man. You save so much money. It's almost, you save 60% of your charges, 60 to 70%. I'm not kidding, man. If you really need a procedure, go to a good, outpatient surgery center, a short-term stay facility, which is accredited. And you get the same healthcare. You probably get a better healthcare. Because once you get into the hospital, you lose control on your bills. You lose control on everything. This is where I suggest a lot of folks, a lot of procedures are being done in an outpatient setting. I had my own surgery center. I used to do a lot of procedures in the outpatient. 70% of my procedures are done in an outpatient setting. I can do a lot of things. If I have, and other than kidney transplant, I can do everything. Most of the procedures are in the outpatient setting, folks. So you really need to watch out. This is the initial part of saving costs in the hospital billing or medical billing when they refer you to the hospital. You can bypass the emergency room if you can go directly to your outpatient facility, have them draw the blood. That'll save you tons of money, man. That'll save you tons of money. Next time the doctor tells you go to the hospital, ER, I said, okay, I will go, but please send me to an outpatient. I don't want to go to the ER. There's, because the charges in the ER are phenomenal. if you can bypass the emergency room, because that's where, they pile up the bills. Go straight to the outpatient facility and have them do blood tests. A lot of folks, I understand folks from, they don't understand the healthcare. You really need to get to the bottom of how the hospitals are being, the hospitals under a lot of stress. I don't blame them, because there's too much rules and regulations, and hospitals are being squeezed left and right. I understand all that, but I think as a consumer, you have every right to know what the costs are. And same thing, when you go to a lab or a facility, ask them how much this is, what it is. I'm paying cash. You have a deductible. You're paying cash. You're not lying. You have a deductible. I'm paying cash. Collect all the bills, folks. You know how you come out ahead? Collect the bills over a period of 5 years, 10 years. You can buy a new car. Yes, you can collect it from your savings, health savings plan. People do that all the time. There's nothing wrong with it. If you have a health savings, that's the beauty of having health savings, because that's your money. You're not borrowing from anybody. You don't need a loan. You can borrow your own money from your health, and it is tax-free. It is tax-free. Folks, if you like what you're listening, hit that like button, man, and subscribe, share, and make some comments. We will see you in the next episode of forpay.org, which serves the consumer. It's a one-stop place for healthcare-related issues. Thank you, guys. Love you. God bless. See you next time.